So we are an FQHC migrant and community health center program in upstate New York, in the western part of the state more. Very rural area. We cover quite a bit of mileage between our health center sites. We have 9 sites. They're not huge sites, but they're really important to the communities that we serve. And one of the issues that we've had is, of course, between our 2 of our furthermost sites, it's about an hour and 45-minute drive. So it becomes a problem for us when we're trying to move our providers around, because we all have workforce challenges with our community health workers that need to get patients from point A to point B, et cetera, et cetera. And then if you are familiar at all with New York State, we're in the Finger Lakes region, and the Finger Lakes are all these lakes that were formed by glaciers that run north and south. The problem is there's no bridge across any of them, so you have to go around a lot of lakes to get someplace. So it becomes a real barrier to patients. So why did we adopt telehealth technologies in the first place? The big thing was to eliminate geographic barriers, of course, because our patients just don't have the ability to get to where they need to go sometimes for primary care, specialty care, dental care, et cetera. A big reason for the use of technology in our health centers using virtual care is reduction of stigma, particularly when you have a person from potentially an HIV positive patient, or maybe they have mental health issues or something else that they don't want to be going to one of the community sites, or they're fearful of going up into one of the urban centers. So it's been a godsend for us to be able to use technology to reach out to those providers so that our patients, who many who are immigrants, they're secure coming to this community health center where they get their normal care. They know the staff, they're familiar. And so if I can bring them back to my health center and have them see their specialty care provider, it's a real boon to them, because it really saves them time, money, worry, et cetera. Additionally, when we talk about the integration of primary care and behavioral health for our patients, it's really convenient when I can say to my patient, okay, here you are, you're seeing the primary care provider, and they might, maybe we want to have you see the behavioral health counselor, but, oh, I'm sorry, she's not at this site today, but we're going to Zoom you into her via video so you can do a virtual call and not have to come back, not have to leave the health center where you're comfortable, and there's a real team approach there. And then finally, one of the big reasons, of course, to adopt telehealth in our health centers was to address the workforce problem we have, which is we can't keep providers with us because the hospital systems come in and we get them all trained really well, and then the hospital comes in and says, thank you, and they pay them some more money and take our providers. And I know that's a national problem for community health centers, so we're no different. So now I'm able to, with technology, be able to have a couple things have happened. So if I have a site, what we've done, our model that we've set up because of technology now, we have an RN at every one of our sites at all times. We might not have an MD or a mid-level provider at that site, but with technology, if a patient walks into the health center where there's only the RN there, she can then create a virtual visit with one of our other providers, and they can do a visit so that I can still see that patient. I don't have to say to that patient, well, I'm really sorry, we have no provider here today. You're on your own, or go to the emergency room, or go to the urgent care. I can have them see one of my providers, the nurse. We've trained our RNs to be able to telepresent and be the hands of the provider. And so they can palpate, they can use all the peripheral equipment we have to see the patient on behalf of the provider so that we can eliminate probably 80% of the problems that the patient has come in for virtually, because a lot of those, if there's some weird thing that the patient comes in for that they have to see somebody in person, well, then we can have them come back. But in a lot of cases, we've been able to mitigate them having to go to the emergency room. And of course, as FQHCs, as we all move into a value-based world, this is going to become more and more important for us to really keep our patients in our primary care settings.